Dr. Tarek Adra.
Courtney Munch.
We're at MyKinetics 365. We like to answer questions that are trending on Google regarding pain. One of them is, what helps with low back pain?
It's true.
Very smart question, but it's not easily answered.
No, it's not.
Because not all low back pain was created equal.
Correct.
In fact, what do we have?
We have three categories of low back pain. One is inflammatory, another is mechanical, and then nerve. And depending on what category you fall into, the treatment plan changes.
Correct. The supplement changes, the exercise changes. So in the inflammatory section, if they have back pain right now, how would they know they have an inflammatory back pain?
You have pain all the time or in all ranges of motion. Everything you do causes you back pain. You're going to need a very specific program
for that, which is different than, let's say you have back pain only in one movement. Like I only have pain when I reach out, or I only have pain when I squat.
Or lift something up.
Or lift something. Yeah. So one range of movement, not painful all the time. That is the mechanical category.
Correct.
Or the nerve, which is what?
You have a zinging pain that runs down the leg or across the side or something.
Yeah. And
burning, tingling,
burning, tingling, numbness, zing, quick, all that. And the reason why we have three categories for these is because the treatments or the program for each of these categories differ.
Yes.
The supplement group differs, the exercise sequence differs, but they all have one thing in common, what we call fundamentals.
Yes.
What are fundamentals and how can they help with back pain?
Fundamentals are things that you do every day in your life, like sitting, sleeping, standing, getting in and out of a car, picking something up. These are things where you have the potential of doing damage to yourself. So we take you through all of those things and how to, minimize that damage.
Yeah, and that's about it. It's MyKinetics 365. We also have other videos here on YouTube that go and address each one of these categories separately, so please check it out. So if you like this video and you found it useful, we actually have a specific sequence program that we've developed over 20 years that includes what, Courtney?
So we do start with the fundamentals, how to do no harm, and then we go into a very specific release program, and then after you have learned to release the muscles that are overworking, how to strengthen the muscles that are not working enough. And typically we get people out of pain in 4 to 6 weeks.
Yeah, and there's also like curated supplements. I mean, it's very unique and it's very specific and very sequenced, and it will actually cost you less than 14 minutes a day.
Yes.
So check us out, mykinetics365.com.